As the Delta variant continues to drive up coronavirus cases, we are now learning more about the virus and how it impacts children. Our national health reporter, Aaron Billups, joins me now with more on that. Aaron, there has now been some back and forth about what precautions schools should be taking in the fall.
That's right. You know, since the beginning of the pandemic, the proportion of coronavirus cases among children has been around 14%. But recently, we're starting to see numbers as high as 22% in terms of the amount of cases among kids. So the numbers are going up. And one way to look at the American Academy of Pediatrics recommendation for universal masking in children is that these experts feel that it's really important for kids, for students to have in-person learning, but that with widespread vaccine reluctance, keeping kids and staff in masks is the safest way to do that. The highly contagious Delta variant is finding every vulnerability in the population, mainly people without immunity, and children are the largest group among those left unprotected. In places with low vaccination rates like Mississippi, we're even seeing a rise in children admitted to the ICU. A study out of Switzerland in the last week shows that about 2% of children with symptomatic illnesses experience long COVID, meaning they may have symptoms that can last for more than 3 months. Now, to be clear, the relative numbers are low because children are still less likely to experience illness, but there is still a bit of uncertainty with the Delta variant as far as the impact to children. This variant was found to be twice as likely to cause hospitalization in adults than the formerly dominant variants. Yesterday, CDC Director Rochelle Walensky says that Delta accounts for more than 80% of coronavirus cases in the United States. So I spoke with pediatrician and epidemiologist Dr. Ayman El-Mohandes. He is the dean of CUNY School of Public Health. He says while the country continues efforts to increase vaccination rates, he agrees with the American Academy of Pediatrics. It's best to protect children with a layered approach that includes keeping those masks on. Take a listen.
We're going to be learning much more about this infection in children, its consequences, its severity, and its outcomes. And so what I'm telling parents is your children are not safe until in the long run that we are all immunized. For the time being, any safety precautions you can take are probably wise.
El-Mohandes says that infrastructure for vaccines to be given in doctor's office, specifically pediatricians' offices, needs to be built up now. He is working on a survey with his colleagues there at CUNY, and they're finding that at least a third of those unvaccinated say that they would get the shot if they could get it done at their doctor's office. So not enough of that is available in places that people trust, Rochelle. So that's one way maybe we can get more people vaccinated.
Yeah, that is definitely a way. People want to go where they feel like they can have a good conversation with somebody they really know well about this. There are a lot of kids, though, who are not getting the virus. Why the push so hard now to vaccinate children?
You know, we just don't know what the Delta variant is going to do and what the impact will be on children. Now, to be clear, only kids 12 and older have access right now to the vaccine. It's not clear yet when it will become available to kids who are younger, but the thinking is better to have them protected against the coronavirus than for them to be one of the few cases, and that number is growing, who actually get sick.
All right. I have to ask you this before you go. What about this Lambda variant? We hear so much about all these different variants. What is this one about?
Right, so it is the next variant of concern that the CDC is watching very closely. This variant popped up in Peru at the end of 2020, beginning of this year, and it accounts for over 80% of the cases there in Peru and has wreaked quite a bit of havoc. I spoke to some experts about the Lambda variant, and it is similar to what's now known as the Beta variant. And so it's expected that the vaccines that we currently have will offer some protection against the Lambda variant, but I think people should just remember that this is another indicator that this virus will continue to move through people who are vulnerable, who don't have immunity, and mutate. And there's a chance that another more dangerous variant could develop if more people aren't protected, Rochelle.
All right, Erin, good information. Thank you.